area ngayon?
We are here at the Wellness and Aesthetics unit. So we will be approaching the biggest room in the unit, which is the Wellness Suite. So you have here your own microwave, what do you call it, television, two televisions, sorry, personal ref, lazy boy. You have your walk-in closet here. Have your walk-in closet here, bathroom, lazy boy, and then the view of the Rockwell Center there.
Pero ma'am, ilang ano dito? Ilang rooms ang available dito?
We have
And
10
what type of rooms ang
We have
available?
10 rooms.
10 rooms.
And we have 4 different types of rooms.
Which are?
The deluxe, the executive suite, and then the couples room. Okay. One of our offering as well is the accupuncture. Acupuncture. So the acupuncture is a complementary medicine. It's used to alleviate pain, stress, reduces stress, and promotes healing. So we'll be meeting one of our acupuncturists here, the program lead of the section, Miss Ino.
Hi, Doc.
Good afternoon. Our acupuncture rooms are welcome, here 2 beds, but usually only have 1 patient. Do you have any
concerns po or questions? For
Usually po ang isang session, how long does it take?
anywhere between 30 minutes to like less than an hour, 45 minutes.
For ilang session yung kailangan to achieve the ano?
Well, we offer usually kasi if it's chronic, bawa matagal na, talagang we cannot really expect it instantly na isa lang, no? So at least a minimum of 6 up to 10 or 12 or even more. But usually we get a result in the 6 or the 12. But if you really want it parang long lasting, I think it depends really on the condition of the patient, no? And what the complaint is, no?
Ma'am, ito po ba yung acupuncture? I'm not very well versed with acupuncture, but is it parang yoga na may iba-ibang klaseng yoga? Or when you say acupuncture, it's the same treatment that you get wherever in the world you are?
Yung may needle.
I know it's a needle, but
Well, acupuncture is part of the traditional Chinese medicine. It's one of the many, Your question is, it's under World Health Organization, no? So we diagnose, we have conditions. It's both a science and an art. But it depends. Hindi kasi katulad ng when you have a headache, it's just basically one protocol. No, in traditional Chinese medicine, it's possible you have a headache, but the causes are different. No, it's due to dampness, or due to heat, or due to a strong emotion. We also take into consideration that and the constitution of the patient, and also where the headache is. No, is it frontal, temporal, and how long the patient has, and what are the underlying conditions. So some points may vary. So, but you are correct in assuming that wherever you are, kasi it's standardized already, whether in another part of Asia or you're in Europe, basta you are certified or you're really a professional acupuncturist, we sort of understand each other. Halimbawa, they say, kasi yung nomenclature, let's say, this is yin tang, or this is somewhere here in near that stomach 36, pero in Chinese that's Susan Lee. So mas poetic yung pero pag miski ako Pilipino na acupuncturist o Chinese o Swiss, pag sinabi kong stomach 36 o Susan Lee, alam namin lahat yun. Pero it depends really on that's why we call that a pattern weaving. We look at the disharmonies, but we ask you several questions, we observe you, we get your medical history, we look at the tongue. Each tongue represents an area of your organ, of your body. We take the pulse. This is a hospital, so it's complementary to Western medicine. So many of our patients also see our doctors, or they opt to try both. Also, that's okay. So we don't really touch the medication, especially if it's maintenance. No? So if they feel better, my suggestion is you go to your doctor and then you will see. And then sometimes they say they want to try. That's also fine. Kasi it's that's complementary. Yeah.
How about yung mga hindi pa ganun ka-comfortable na tinutusok-tusok ng needle? How do you convince them to actually try?
I tell them, it's not really, of course you'll feel something, di ba? Pero hindi naman siya to the point na sobrang sakit. Like maybe minsan may konting electricity, may konting jolt, may konting ano. It's supposed to last only for a few seconds. Oo, then I tell them, if it's really painful, you tell me. Alisin natin, maybe we'll look for another ano. Sometimes also if you're very tense, so it's hard.
Kinakabahan.
Pag ganun ka, no? So matigas yung muscle. So minsan mahirap ipasok. So it's a very thin, parang buhok lang natin. So it's not really painful. But halimbawa, there are also some points that might be a bit painful. I tell them, you might feel something, ha? Pero a few seconds lang yon. Usually, all of our patients naman are good with it. Nakaya nila yun.
Tolerable.
Oo. Hindi naman, oo.
Tanong ba kayo?
Doktora, paano nga po how to get in touch?
With us.
Apa.
You can call us, there's the number. So there's a trunk line, then you can ask to be connected to wellness, and then if you want acupuncture, you just tell them, like, look for Amy. I'm actually, I'm an acupuncturist, no? I'm not a medical doctor. Okay, so ano yun, but I'm certified. Amy, Miss Amy. It's okay. Some people insist on calling me doc, but I just want to set the record straight. So there are two acupuncturists in the Philippines, a medical one and a non-medical one. So we're certified also by DOH under PITA. So I am in a non-medical but we learn the same thing under PCM.
Miss Amy, since we're in the wellness and aesthetic institute,
Yes.
Kasi nababanggit kanina parang kung may masakit sa'yo, you go acupuncture. But what if naman yung mga cases na, paano ba sabihin ito? Yung may mga erectile dysfunction, yung mga gano'n, like yung parang overall wellness lang and health, not necessarily an illness.
That's also part of traditional Chinese medicine. You'll be surprised, no? Reproductive issues both for male and female, including erectile dysfunction and prostate issues, fertility issues for women. That can also be fixed or helped. Sometimes kasi I cannot pwede rin. That's also possible. Although usually it's the male who does that, but pwede yun, kaya yun. So I suggest to our clients or our patients, please go see the doctor. And then tell me what it is para sigurado tayo.
Question kasi ito, how about yung mga arthritis? Naalala ko lang kasi nanay ko meron. She's a very bad arthritis.
Kaya yun.
Kaya siya.
That's called in Chinese medicine, it's Bai syndrome. Again, it also will depend on how long and if it's prolonged, no. But it can be helped. At the very least, I will tell you, there will be some relief. No, and then, kasi minsan pumupunta sa amin dito, medyo, yung
malala.
Pero they see a doctor na rin, okay lang. I will not stop them from, kasi ayaw lang nila minsan ma-surgery. Naintindihan naman natin yan, kasi yun na yung mga last resort. So, gagawin natin, kung makakatulong go, then go back to your doctor. But really the best is prevention, but minsan di mo rin ma-help kasi may disposition ka, di ba? May genetic disposition ka. Miski lahat ginawa mo na lumilitaw pa rin, So, but it can be it's possible. Yeah, it's one of the earliest diseases that the TCM has So they have a different name. No, but when you look at it, that's it. So, so it's also important. Western medicine has its strength, and the traditional or alternative medicine has its strength. So we take it together.
Thank you.
So, Wellness and Aesthetics Institute is divided into inpatient and then the outpatient. So, you'll be going back again to the outpatient, which is the 6th floor.
Okay.
So, Miss KitKat will be with you.
Okay.
Thank you so much.
Thank you.